Well, on Tech Daily today, we're taking a much more interesting field. There are a lot of engineers. I'm sure many do know that. But when it comes to biomedical engineering, it holds a special place. What makes it unique and why is it so important to us as Ghanaians? We are going to explore that subject briefly because I've been joined by the founding director of GH Scientific and as well the head of Biomedical Engineering Department at the Academic City University, Dr. Hephzi Tagoe. Doc, good morning.
Good morning.
Welcome to the show. We are grateful that you could make the time to join us.
Pleasure to be.
Biomedical engineering, where the interest came from. Can you tell us?
Right, okay. Where did the interest come from? The love of science, love for healthcare. I jokingly say we're the medical school rejects. Yes, I mean, as a young sixth former trying to navigate university courses, trying to merge your interest, options within the healthcare sector, that's not necessarily medicine, and biomedical science was one of the options that came my way.
As head of department at Academic City University, and looking at what we are dealing with in our country, how critical now is biomedical engineering when it comes to improving healthcare access?
Right, now so more than ever, and it's only just starting to take off, especially when we look at the state of healthcare in our rural communities, even healthcare within the cities and the technology available to us today. So how best can we harness the tools that we have to help improve some of the deficits that we have in our healthcare system? And biomedical engineering sits perfectly bridging those two interventions. And so how can we cut back on patient wait time? How can we cut back on diagnostics time? How can we utilize the tech we have today to help facilitate the honing in on shortlisting potentially what patients will be presenting with in a clinical setting, whether within rural communities, within school clinics, within major hospitals, and that's where biomedical engineering comes in.
Talking of that, it means it requires a certain level of investment and interest from all stakeholders to ensure that we achieve the success rate that we want to see by way of implementing biomedical engineering in our healthcare facilities and across the board. As a country, do you think we've taken much interest in that?
Are we interested in healthcare? Yes. Do we have a long way to go? Yes. As a country, are we all responsible for supporting the progress of healthcare in the country? Yes. So then practically, what does that mean? It means that if we're not necessarily having a percentage of, let's say, the country's GDP allocated to medical or scientific research specifically, within our institutions, what can we do? Within our communities, what can we do? What projects can we encourage our students to work on that can support the communities that these institutions are based in? And so, yes, as a nation, we're all responsible, and I believe everyone can do something in the spaces they find themselves to support our healthcare in general.
Given the challenges that we see, despite the long way that we have to go, there are some wins, right? Are there wins that we would see that we've done this so far, so it means we can look at this and move ahead to the better?
Yes, plenty. So the recent one, I know Bank Hospital actually have their own in-house X-ray viewers that they developed and launched earlier this year, if not end of last year. We know people like Minor Health who have been, leading in the space for, a few years now, before even the whole AI and machine learning and in healthcare, took off or came into the limelight. We have a startup in Kumasi, Incas Diagnostics, who actually developed their own in-house rapid test kits during the COVID, and there are many more products they manufacture. Even at Academic City, we have some of our students who donated ventilators during COVID to some of our local hospitals. They've made surgical lamps, etc. So, yes, we have come a long way in terms of locally produced or locally innovative interventions. We have a generation of hungry incrumerists, I like to say. Ghana is at the heart of the progress we want to be making and contributing to the country. So certainly we recognize there's a long way to go, but we have a lot more intentionality in what we can do to support the healthcare sector where biomedical engineering is
I must
concerned.
confess, the first time I heard of biomedical engineering, it's through a friend who knows someone doing it as a PhD in the US. So I didn't even know we had that program being even run in Ghana. But now that we have, means that, as you mentioned, intentionality means there is some work to ensure progress. But largely for young persons who want to perhaps not consider themselves as a medical school rejects and have the interest. You had a department that's looking at it, at training young persons, bringing out the innovations and all of that. What more can be done, really, to ensure that we have more people entering the field by way of mentorship, partnerships, collaboration, funding, investments, and all of that?
Yeah, so it's interesting. You first said about biomedical engineering when your friend was in the PhD. As a program, it first launched in Ghana in 2004 at the University of Ghana. And our quiz mistress is one of the pioneering biomedical engineers in the country. And so it has been running at least for 2 decades now. The advantage we have now, population is increasing, healthcare is advancing, so we have a lot more institutions that are also offering biomedical engineering as a program. And so for young people who are considering taking a career in that sector, it's, of course, you need to get the grades to get in first, entry requirements. For us at Academic City, it sits under the Faculty of Engineering. And anyone, we're looking at doing bridging programs, but at the moment, if you do have the interest in engineering, in healthcare, you have an interest in seeing how best you can merge, design thinking, innovation, practicalities towards supporting the healthcare industry, then of course anyone is encouraged to apply and explore that program. The various areas of biomedical engineering is not necessarily clinical engineering. So by clinical engineering, we're talking specifically working within the hospitals. But of course, you have the entrepreneurship route, you have the manufacturing route, you have the product development route, et cetera, et cetera. And so wherever your interest is, so far as you do enjoy healthcare, you like making, you like creating, and you want to explore these mergers, biomedical engineering has a home for you.
You mentioned the quiz mistress, and so I'd want to bring in something I saw with the NSMQ, where I do know that they now have a science fair as part of the entire program, which I believe is very commendable. It's good. Because I look at our ecosystem, we import virtually almost all of the medical equipment we use in the country. How does biomedical engineering fit into that? And what would you need to ensure that at least we have the imports of medical equipment into the country?
Okay. That importation ecosystem needs a lot of unpicking. But it's about supply chain, it's about logistics, it's about, I suppose, confidence in feeding that pipeline. Do we have the skills and expertise to be able to produce locally? Yes. I mean, I saw your last guest was a 24-hour economy innovation. And so can we bridge that gap? Yes. But without getting to, I don't know, political, it's a lot of unpicking to be done when it comes to why we're still importing so many medical devices. Having said that, as I said, we still have local manufacturing that has taken off. Many more are still coming through the pipeline. We also, one of the downsides actually of the importation, it's the equipment that we have sitting in our clinics that's are waiting on repairs, right? And so if our locally produced can almost give that confidence that we can keep feeding that pipeline, then it will be easier to keep it flowing. But it's not as straightforward. Let's stop importing and manufacture locally. Can it be done? Yes. And hopefully the 24-hour economy people will give us healthcare factories so that we can keep feeding
our hospitals and various health centers across the country. You mentioned Professor Elsie Kaufman.
Correct.
And you mentioned the program Biomedical Engineering has been running since 2004, right?
Yes, that's when UG first launched.
Yeah. So that's give or take 21 years.
Yes.
You have gone through the system. You now had a department looking at biomedical engineering at the Academic City University. I just want to ask you finally, 10 years from now, when you look back to this interview, what would you be expecting? What will give you the satisfaction that Ghana has really progressed?
Okay, so rural communities are going to be using homegrown diagnostics that are low cost, that are easy to source. Now, healthcare in general is moving towards personalized medicine. We know many of our hospitals and our clinics are at the long waiting line of patients. We can, telemedicine, right, with some of the projects that students kind of come up with these days, you can implement telemedicine where we don't always necessarily have to go queue up in hospitals or clinics unless, of course, it's an emergency. If we are able to preventative medicine as well, also sit within biomedical engineering, right, population, lifestyle, etc. If a lot more people are aware of the locally made products, diagnostics, interventions that we can access, if we don't have to fly people to the West to seek medical interventions, we don't have to wait 2-3 weeks for certain medical lab results to be released to our hospitals, that would be significant progress, starting with the patient experience when they first have to access healthcare and how locally we've been able to bridge and improve that customer experience.
At the core of your futuristic outlook is improving access to healthcare, and I think that's beautiful. Dr. Hephzi Tagoe, we are grateful that you could join us for this conversation. I promised you it will be brief, and I managed to keep it brief. She is the head of the Biomedical Engineering Department at the Academic City University. She's always available, and you could reach her if you have the interest. We are encouraging young people to get into the field to help us improve access to healthcare in the country. It's time to do some celebration.